going to discuss musculoskeletal system. Okay. So musculoskeletal system is the easiest to remember. Okay. So skeletal system contains bone, cartilage, and ligaments. Okay. So there are different types of bones, and long bones, short bones. Okay. So in long bones, we have thigh bone, lower leg bone, upper leg bone, and short bones are wrist and ankle bones. Okay. Every long bone have three part: epiphysis, metaphysis, and diaphysis. Okay. So epiphysis, if in this image you can see that epiphysis is the upper end and the lower end. Okay. And metaphysis is after the epiphysis, and the shaft part, the middle part is shaft, which is known as diaphysis. So this is the clear picture: epiphysis, metaphysis, and diaphysis. Okay. We have total 206 bone in human body. Okay. And these 206 bone divided into two system: axial skeletal system and appendicular skeletal system. So in axial skeletal system, there are 80 bones, and appendicular, there are 126 bones. So in this image, the purple portion is axial skeletal and the pink portion is appendicular skeletal. So your arm and leg bones are in the appendicular, and your head, spine, and chest bone are in the axial skeletal. So axial skeletal consists skull, ribs, sternum, vertebral column, है ना? And appendicular, again I told you that the bones which are in the extremities. Okay. So we have a lateral view of skulls. Okay. So if you can touch your skull from back side, you will feel a cup side shaped bone that is occipital. Okay. So are you able to locate occipital? Yes. Then we have parietal bone. These are the parietal bone, the blue one. Then we have temporal bone. The ear side bone or temporal bone. Then we have frontal bone. Hmm. Then we have ethmoid bone, the purple one. Yeah. Then we have sphenoid bone. Yeah. Sphenoid bone just behind the eye. Ethmoid is the not the purple one, this one, ethmoid. Yeah. Oh. Yes. No. This is the ethmoid. And the purple one is the sphenoid behind the eye. The nose bone is lacrimal. Then we have upper jaw and lower jaw. No, nasal bone, this one. Major. Yeah. Then we have upper jaw and lower jaw. Upper jaw is maxilla and lower jaw is mandible. Okay. Then we have cheekbone, zygomatic bone, the green one. Then there are joints also. These are the suture joints. Stitching. Yeah, suture joint. Okay. And the joint between mandible and temporal bone is known as temporomandibular joint. Temporomandibular joint. Yeah. This is the frontal view of skull. Yes. Then we have ear bones. There are three bones in ear, which are malleus, incus, and steps. Malleus, incus, and steps. So these three bones are in ear. We call it MIS, MIS, MIS. Malleus, incus, and steps. Then we have spine bones. So there are 33 bones in spine. Okay. And divided in the five part: cervical, thoracic, lumbar, sacrum, and coccyx. So in cervical, there are 7 vertebrae. So each bone known as vertebra. And in plural, we called it vertebrae. Okay, so there are 7 vertebrae in cervical spine. Thoracic, we have 12 vertebrae, lumbar 5, sacrum 5, and coccyx 4. Okay, so the sacrum 5 diffuse and make it one bone. So if you say, if somebody asks that how many bones in spine, you can say 33, it is correct. Or if you can say 29, that is also correct. Then we have thorax bones. So there are 12 pairs of ribs, 12 on the left side and 12 on the right side. So 12 pair on the ribs. है ना? Then we have sternum, the breastbone. Yeah. Then we have a clavicle bone, collarbone. Clavicle bone, also known as collarbone. So there is a joint between sternal and clavicle, sternoclavicle bone, sternoclavicle joint, joint between sternum bone and clavicle bone. Ribs also known as costo. Yeah, costo means ribs. Any query till now? Then we have appendiculoskeletal. We have upper extremity and lower extremities. So in upper extremity, we have bone like humerus. So this is the humerus bone, okay, in upper extremity. Then we have two bone in the forearm, okay. Forearm we have two bone, radius and ulna. So I will show you the different picture. Okay. So these are the upper one, humerus. Humerus. Yeah. And we have shoulder girdle that known as scapula. Scapula is shoulder girdle. So if you put your hand on your friend's back, so you always put on scapula. Then we have two bone in forearm. One is radius and one is ulna. So radius is on the thumb side. Yeah. And the body side bone is ulna. Yeah. So radius and ulna. Then we have wrist bone. So currently we are not discussing any joint. Joint we will discuss after the bones. Then we have carpal and metacarpal bone. Carpal bone and metacarpal bone. Then we have phalanges. Okay. So in upper end we have clavicle, scapula, humerus, radius, ulna, carpal, metacarpal, and phalanges. Okay. And combined like we can say thumb and fingers. Okay. Then we have lower extremities bone. So we have pelvic girdle. We have pelvic girdle. Okay. So there are three bones in pelvic girdle. Okay. Ilium. So it's not ILEUM. It is ILIUM. Ilium, ischium, and pubis. Okay. Iliac, yeah, ilium, both are same. Okay. So ilium, ischium, and pubis. Okay. Then we have thigh bone, which known as femur. Femur. Femur is the longest bone. Okay. Then we have patella, kneecap. Then we have lower bone, lower leg bone, tibia and fibula. Tibia. Tibia and fibula. So the maximum weight is on tibia. When you stand, then your maximum weight is on tibia. Tibia. Yeah. Then we have heel bone. Okay. Which known as calcaneal bone. Heel bone known as calcaneal bone. Then we have tarsal, metatarsal, and phalanges. So in hand we have finger and thumb. But in foot we have great toe and toes. Yeah, in foot. Okay. So great toe and toe. Then we have joints. So these are the common bones. Okay. Which are, so just go through your body. Okay. Start from this occipital, parietal, frontal, temporal, mandible, maxilla, nasal, ethmoid, sphenoid, zygomatic. Okay. Then we also have four sinus. Okay. Sinus are the hollow area. So there are four sinus: ethmoid, sphenoid, maxillary, and frontal. Okay. Ethmoid, sphenoid, maxillary, and frontal. Then we have upper extremity bone: clavicle, scapula, humerus. Then we have radius, ulna. No. Then we have carpal, metacarpal, है ना? Phalanges. Then we have lower extremity bones, pelvic girdle. We have three bone: ilium, ischium, and pubis. Then we have femur. Then we have kneecap, okay, which is known as patella. Then we have tibia and fibula, calcaneal bone, which is ankle bone. Then we have tarsal, metatarsal, phalanges. And again, we have toes and great toes. Then we have spinal cord divided into five part: cervical, yeah, 33. Cervical, thoracic, lumbar, sacrum, and coccyx. Okay. So 7 cervical, 12 thoracic, 5 lumbar, 5 sacrum, and 4 coccyx. Then we have chest bones, we have sternum, we have ribs. Okay, there are 12 pairs, not 12 ribs, 12 pairs. 12 on each side. 12 on the left side and 12 on the right side. Then we have xiphoid process also. Okay. Then we have 3 bones in the ear: malleus, incus, and steps. So these are the bones in human body. Then we have joints. Okay. So there are different types of joints. We have pivot joints, we have hinge joint, we have saddle joint. Okay. We have ball and socket joints. So the first joint I told you that temporomandibular joint. Temporomandibular joint. Okay. Then we have shoulder joint. Okay. In shoulder, there are acromioclavicular joint also. There is a acromion process near the shoulder. And then we have acromioclavicular joint also. Okay. Then we have sternoclavicular joint. Joint between the sternum and the clavicle bone. Yes. Sternoclavicular joint. Okay. In spine, we have intervertebral joint. So whenever there is two same kind of bone, the joint between them connected with the inter. So there are two vertebrae. So between two vertebrae, there will be joint which will be called as intervertebral joint. Okay. And similarly, in these are the phalanges in your fingers. So the joint between two phalanges, interphalangeal joint. है ना? Then we have, after shoulder, we have wrist, elbow joint, elbow. Then we have wrist joint. Then there are bone metacarpal and carpal. So the joint will be known as carpo-metacarpal joint. Carpo-metacarpal joint. Then we have metacarpal and phalangeal joint. So metacarpo-phalangeal joint. Metacarpo-phalangeal joint. Metacarpophalangeal and carpo-metacarpal joint. Okay. Then we have hip joint. Yeah. Hip joint is also known as ball and socket joint. Okay. Hip and shoulder are bone and socket joints. Then we have knee joint, ankle joint, okay, tarso-metatarsal joint, and metatarso-phalangeal joint, and interphalangeal joint. There are three connectors, bone to bone, one bone attached to another bone, that known as ligament. Yeah. And bone to bone If you're born to muscle, if you're born connected with the muscle, then it's called tendon. And muscle to muscle connectors are cartilage. Yeah. So how to remember BBL, big vest league, BBL bone to bone ligament, है ना? BBL, BMT and MMC. So if you remember, you want to remember in the abbreviation format, it will be easier for you. Yes. Okay. Okay. There are three compartments in knee: patellofemoral compartment, lateral compartment, and medial compartment. Then we have knee ligament. So there are four ligaments in knee: anterior cruciate ligament, which is known as ACL; posterior cruciate ligament, PCL. Then we have lateral collateral ligament and medial collateral ligament. So there are two collateral ligament and two cruciate ligaments. Okay. So ligament is connection between bone to bone. Yes. Okay. Then we have shoulder anatomy. There is a rotator cuff which rotate our shoulder. Then we have supraspinatus, subscapularis, infraspinatus muscles. These are the muscles in shoulder area. Teres minor, teres major muscle. So these things you need to remember when you do a coding for knee or shoulder or hip. Until unless you did not remember these bonds and these terms, then it will very difficult to code orthopedic surgery reports. Because in orthopedic surgery, you are very aware, much aware about all the anatomy. Okay, all the body part. So the our chapter name is musculoskeletal. Until now, we discussed the joint and the bones. There are muscles also. Okay. So there are three types of muscle: skeletal muscle, smooth muscle, and cardiac muscles. So those muscle we have controlled. Like I can move my hand, I can move my shoulder, head, any organ. है ना? So these are the skeletal muscles, or you can say striated muscle or voluntary muscles. But we cannot move our organs, liver, gallbladder, intestine, but they move because any organ can only move if it's connected to the muscles. So these muscles are called smooth muscles. है ना? And the muscles for the heart, these are the cardiac muscles. Cardiac muscles. So we have skeletal muscle, smooth muscles, and cardiac muscles. Any question related to the anatomy? No. Then we have disease of the musculoskeletal system. So the common disease is fracture. So there are two types of fracture: open fracture or closed fracture. In open fracture, the bone come out from the skin. You can see the bone. Yeah. Then it's open fracture. In closed fracture, the bone remains inside the skin. Okay. So this is the example of open fracture. Yes. The bone come out of the skin. And these are the closed fracture. Open fracture, closed fracture. Then we have dislocation. No. Bone can never dislocate. Only joint dislocate. Then we have degenerative disc disease. Then we have degenerative joint disease, herniated disc, which also known as slip disc, arthritis, inflammation of the joint. Arthro means joint. Then we have bursitis. Then we have sprain and strain. Then we have musculoskeletal conditions, bone disorders, fracture, skeletal dysplasia, osteoporosis. Osteoporosis, like if you have wooden furniture, then mites, if there is a mites, then it's a become very weak. And in similar, we have in osteoporosis. So if the bone weaks, if you fall down, then your bone will break. Okay. Then we have rheumatoid arthritis, osteoarthritis. These are the common diagnoses. Tendon injury. Then we have procedures. We have close treatment for fracture. Then we have open reduction internal fixation, which is known as ORIF. The physician may cut, and if you want to introduce any, put the any instrumentation or any device, you need to correct the fracture site. Okay. Arthroscopy. Arthroscopy is the instrument which inserted in the joint, and then physician uh, evaluate what is the condition of that joint. Is there any injury or any tear happen over there? Okay. Then we have joint replacement. Joint replacement is not common in India. Okay, this is the last step which normally physician do. Okay, because it's a very infectious procedure. If anything happen, then infection is spread very fast in joint replacement. So always physician or physiotherapist advise to do the activity normally rather than go for the joint replacement. Then we have arthrocentesis. In that, joint has been punctured, and sometime they aspirate the fluid if there is a fluid collection in your joint, and if there is a huge severe pain in your joint, then they also put the injection medicine through arthrocentesis. Okay. In arthrography, they put the dye and take the picture. Okay. Biopsy can be taken from any body part. Okay. So it can be muscle biopsy, it can be bone biopsy, it can be liver biopsy, it can be gallbladder biopsy, skin biopsy, pancreas biopsy. Okay. Then we have arthrodesis. It's a spinal fusion. Okay. Spine fusion. And sometimes if blood vessel has been damaged of the lower extremity, then physician also do the amputation. Okay. To cut that part. Then sometimes they just manipulate and treat the fracture. Then we have external fixator, है ना? Uniplanar and multiplanar. If it's a one side, it's a uniplanar. It's in more than one side, then it's a multiplanar. So these are the common Diagnosis, procedures we have in musculoskeletal system. For diagnosis point of view, there are some more diagnoses which we can discuss. We have osteomyelitis, osteomalacia is a softening of the bone. Okay. Then we have three spine disorder: lordosis, kyphosis, and scoliosis. Lordosis, kyphosis, and scoliosis. Scoliosis is the side way. Somebody accept. Pushpa. Pushpa have scoliosis. Yes. Okay. These are already discussed. Then we have carpal tunnel syndrome. Yeah. So if you work long time on your system desktop and use the keyboard, then your medial and ulnar nerve will compress. Okay. Hmm. Tumor cancer can happen anywhere. है ना? Even in bones also. Yeah, bone also. It's a osteosarcoma. Sarcoma is cancer. Sarcoma, carcinoma, all these are cancers. Multiple myeloma is also cancer. Myeloma. This is the brief about the musculoskeletal system. So you need to go through these and make a notes, है ना? Then only it will benefit.